People over 50 years old and those with weak immune systems may now get a second booster shot for COVID-19. Both the U.S. Centers for Disease Control and Food and Drug Administration approved the expansion of the emergency use authorization for a fourth dose. A second booster can be given 4 months after the first one for Pfizer and Moderna vaccines. Let's find out why global experts are recommending a fourth shot from former U.S. FDA Associate Commissioner Peter Pitts, joining us live from New York. Professor, thank you so much for joining us. In your view, is there really a need for a second COVID-19 booster dose for people age 50 and older like myself?
Well, and me. I think one of the lessons learned from COVID-19 is that we've got to protect those most at risk. And those are older people and people with pre-existing conditions and those who are immunocompromised. Relative to antibody levels, more is better than less. And even though we don't really understand what a sufficient, robust antibody count is, clearly these vaccines wane over time. And the key goal here is to keep people out of the hospital and make sure that when they do get infected, the symptoms pass quickly and they can regain and retain normal activities. So a booster is a good idea moving forward.
But, Professor, is the waning immunity because the first booster is only half the dose of the primary shots?
Right. That has what the data the FDA looked at showed that was the minimum dose that provides the maximum robustness of antibody count. Clearly, you don't want to give people too much of anything. And the data that the FDA reviewed spoke to a booster shot, which is half of one dose of the mRNA vaccine. It gets the job done. It's less rather than more, and that's exactly how you want to weigh the risk benefit for these types of propositions.
So, 4 months. So, if an individual has had their first booster in January, then the second booster then must take place already this April then.
That would be the soonest, but of course, this doesn't mean that the vaccine's efficacy without a booster is useless. It does not go down to zero. If you've been vaccinated and had a booster, your immune system is ready to take on COVID-19 and win. The point is that a more robust antibody count is better, and specifically for those most at risk. So this really is a conversation about protecting those most at risk. I still think that the key public health message here is to those who have had no vaccines at all. And that message is get vaccinated. It's really important to protect both yourselves as well as your neighbors and your communities and your country.
There's still a lot of anti-vaxxers out there, Professor Pitts. What about if they just get the booster but not the primary doses?
One of the dangers of vaccines is to be under-vaccinated. That allows the virus to learn the protective measures you've put in place and morph and become something more dangerous. It's really crucial to get the full dose. As the science says, getting half a dose with nothing else does not get the job done. And in fact, it helps the virus to learn about the vaccine and become stronger. So that's actually a bad thing.
Professor, we're now seeing the more contagious Omicron subvariant, which is the BA2, causing new waves of infection in major European countries as well as in China. But here in the Philippines, the cases are really down to pre-Omicron levels. Infections, hospital utilization, deaths are all down. What are the risks of another surge happening?
Well, I think there's a difference between a surge in infections and a surge in deaths and hospitalization. What's happening here in the US and in many countries that are largely vaccinated is that even though people can get infected by the more infectious variant, they're not having serious symptoms. They're not going to the hospitals. Our hospitals are not being overcrowded, and that's key. That means that the COVID-19 virus is moving from a pandemic to an endemic, kind of like the annual flu. We're in control. We're mitigating it, and people are not at risk for dying or having serious manifestations, and that's victory against the virus by any means.
So if you say that the pandemic is ending and the endemic is beginning, so when are we likely to see the end of it?
Well, that's kind of like asking when are we going to see the end of the annual flu? I don't know. It's likely that we may never see it. We're used to the annual flu coming around every year. We get our flu shots. The same is going to be true for COVID-19. I'm hearing that there's going to be one single shot for the annual flu and an annual COVID shot. So we can still get that one shot for both. And this is a great teaching moment for the population to explain to them the value of vaccines and how vaccines work.
I mentioned China earlier. There has been a lockdown in one of its financial hubs, which is Shanghai. China is still pushing for a zero COVID policy. Is it still advisable?
I think a zero COVID policy is a failed policy. We're not going to eradicate the virus. We need to mitigate it and remain in control. I think, obviously what this points out is the relative weakness of the Chinese vaccine. It's not as efficacious as many of the vaccines that we're using here in the US. And when you have a vaccine that doesn't work, you need to find other strategies. I suspect a better strategy, rather than locking down their economy for a second time, is to seek out a more effective vaccine from Pfizer, BioNTech, Janssen. Other countries are using these programs with great effect. But using a vaccine that doesn't work is almost worse than using no vaccine at all.
We're talking about a second booster for the immunocompromised and for individuals older than 50. Professor, what about the young and healthy people? How soon will they need the fourth shot?
That's a good question. The answer is that scientifically, we don't really know how their antibody levels are decreasing. I think over time, it's going to be approved for the entire population, just as a single booster is approved now. I think what's important to understand is that these are still being authorized. They don't have full FDA approval. There's still data being collected. And I think that as we have more data, the FDA and the CDC will be able to make a smarter recommendation relative to the whole US population.
Former US FDA Associate Commissioner Peter Pitts, thank you so much for your insights and for joining us from New York.